in the system and opportunities to improve access from the client's perspective to the system. I think both Comey and I, at least in our conversations, are very pleased. Vision Action Network used the funding to hire Trillium advisors, and they convened a stakeholder group from the community and created a report, and Comey and I are very pleased with the report. They provide 6 recommendations that they'll go over with you today, and the recommendations are very complex, and so we're just looking to see what your thoughts are today about the recommendations, and then staff will go back and further analyze and come to you again. And Comey's going to add to that a bit.
Well, yes. Good afternoon, Commissioners. So our system has been evolving to serve the homeless here in Washington County. Our capacity is we serve about 3 out of 5 people that need the help. And there's more details on everything I'm about to say, but Annette is here in the audience if you want to dig deeper. But the gaps that we know is the homeless have to knock on different doors to get service. We also know that outreach is difficult because we have 2.5 staff. Housing navigation is something else we are working on. On the good news side, we have Office of Community Development has an emergency shelter grant that is going to really help with getting outreach workers out there. Housing First, which is something you will hear about from the consultants, is also part of our Built for Zero initiative, which is a national best practice for rehousing high acuity, chronically homeless persons. So that is working. During the 5 months of this year, we've rehoused 44 individuals with a combined 131 years of homelessness between them. The Kaiser Permanente's Metro 300 funding was instrumental in that. So shifting gears to the issue at hand today, I think February 2019, CSH, which is Supportive Housing Group, released a report that says Washington County needs 226 permanent supportive housing units. We have 34. The Metro Affordable Housing Bond committed to 100 PSH units. So as Marnie mentioned, last fall we were thinking proactively about how to address some of these gaps in our homeless systems. That was when the supportive housing bond was just a mere conversation. So we work with VAN to contract out with Trillium, as Marnie mentioned, and we are here today to hear from them. We are pleased with the report. I want to second that. So thank you. And with that, we'll hand over to Trillium. I think they are going to be joining us remotely.
Yes. Thanks, Comey.
We'll step away, and then if we can come back in the end if you have questions for us.
Can everyone hear me okay?
Yes.
Thank you. You can advance the slide, please. So Comey and Marnie had shared much of the backdrop that I was going to, so I'm going to spare you the repetition of that. But in essence, these conversations that began with the Thrives Collaborative, Washington County Thrives, and county staff centered around permanent supportive housing, or PSH, which is essentially the combination of permanent affordable rental housing with wraparound services that help people remain stably housed. And when done well, we know that it increases housing stability, it improves health conditions, and it lowers the overall cost of a burden on public services. Next slide, please. When the county asked VAN to convene an ad hoc work group and act as the pass-through agent of funding to hire a consultant, we selected Trillium with the help of some of our leadership team from Thrives. And the primary responsibility for the consultant was to engage both the work group that VAN had convened, as well as a diverse cross-section of county stakeholders who are actively engaged in these so-called wraparound services, and to study the current system and to glean feedback from stakeholders on what's working, what's not, how they might see things differently. And the second thing was to then develop recommendations around how to improve this system. And all of this was completed, wrapped up by the end of February of this year. As you recall, we were going to give a presentation, you may recall, in March, actually on St. Patrick's Day, but COVID-19 got in the way. So here we are. And in May, the Metro Homeless Services measure passed, which stands to generate millions of dollars in new revenue for Washington County. And to me, that makes this conversation around a more effective service delivery system all the more relevant. So the process was a good one. I'm pleased to hear from Marnie and Comey that they were happy with the report and how this process unfolded. That was also affirmed by the work group and the stakeholders. And the recommendations you're going to hear in a moment were informed by those very people. So I appreciate the county's leadership in stepping up and supporting this effort and engaging Van as a convener in the process. And I'm going to turn it over to Marcus Mundy from the Trillium Advisors team. Marcus?
Good. Thank you, Glenn. Thank you, commissioners, for letting me join you today. It's good to see some of your, well, at least your disembodied voices for now. Next slide, please. The headlines. I'm here to tell you about the headlines and the scale of the problem. I'll start with the headlines. The permanent supportive housing system is compliant, but it doesn't work quite as well as it should or it could. And what we're trying to do with this report is kind of suggest some higher functioning systems. But the problems as we've identified them is that sometimes the funds and services are in silos. And even though the system, it involves multiple stakeholders, it does lack clarity and accountability in spots. You know, the homeless are forced to navigate very complex bureaucracies, which is tough for them because they're already homeless and yet they're having to face all these administrative impediments. It goes without saying, but I'll say it, people of color bear the brunt of this ineffectiveness. You know, the system doesn't work for everyone, especially not BIPOC folks. Community partners and senior county staff, even some of your own staff, they recognize the flaws, but they also are some of the best positioned people to take these recommendations and turn them into something operational that does work for the county because they talk to the people on the ground, they intake the people, they see what's going on, so they know it doesn't have to be this way. Both your outside collaborators with your nonprofits and the folks right in the county. So in our own process and research at the coalition, for example, we had a recent report based on Washington County on housing that speaks to some of these issues. But even our own research tells us it doesn't have to be this way. And lastly, and I know Ruth Osuna actually came with us when we talked to the folks down in California with Brilliant Corners. We do see other mechanisms, you know, where there's systems that works that's not a panacea, but they have strong concepts, there's centralization, they cut through red tape, and some of what we're going to suggest is along those lines. So next slide, please. So the scale of the problem. So Washington County's count of people experiencing homelessness jumped 17% in the last year to 618, and I'm certain that's from a one-day count, which is an imprecise measure, but even a one-day count showing that big a jump is significant. In 2018, the published data of folks who accessed the system was 1,547. Well, that data is 2 years old, and that data predated COVID. So without even saying it, you already know the numbers are much worse, real time. You know, there is a tsunami coming, which is why we're talking about this. 77% of the residents say reducing homelessness is a high priority. There was a survey done, of one question survey recently, because I participated in yet another wonderful Washington County listening session last night. But we asked the residents of your county what are their top priorities. the number one answer was housing, homelessness, access to affordable housing, even more so than the police issues, than the issues surrounding racism, which are in the news right now, even more so than the budget. Your own residents from your own survey said we care the most about reducing homelessness, housing, and homelessness issues. So the scale of the problem is real, and it's right now. The funding dedicated specifically to homeless services was $10 million last year. And, Glenn mentioned it, but the 60 or 70 million that's going to flow to Washington County for Metro annually, it gives you an opportunity as commissioners and as folks who are deciding what happens next. And again, I will go back to our COVID moment. COVID hasn't changed anything right now except the severity of everything you're going to have to decide upon. So that's the scale of the problem, and that's what I hope you all keep in mind. That's my section right now. I'm going to pass it on to Margaret, who's going to talk about the opportunities.
Good afternoon, commissioners. My name is Margaret Van Vliet. I am the principal at Trillium Advisors, and I'm really happy to be spending part of your afternoon in your work session talking about these issues. We think the work was really solid. It was a good process, and we're really appreciative of the leadership of Washington County in really trying to think deeply about systemic change that might be necessary. So this is a look at your current governance structure that it's really the bedrock of your homeless services system. It's this Housing and Supportive Services Network. Sometimes we shorthand it as HISN. It's also technically called the Local Continuum of Care, or COC. And it's actually a mandated structure that HUD requires in order to receive certain streams of funding. Now, the HISN, as this chart shows, reports to the Homeless Plan Advisory Committee, or the HPAC. And as you, I'm sure, well know, members of that HPAC are appointed by your board. The HISN in turn has several subcommittees that go deep in specific issues like children, youth, veterans. And as you can see, the Venn diagram here shows it has overlap with Washington County Thrives, ICH, and CHA. So this is a structure that is pretty typical. It certainly is what HUD asks for, a broad-ranging, lots of stakeholders involvement. So it meets those very basic HUD parameters. But it's more bureaucratic, truthfully, than it needs to be. And it lacks cultural competency and effectiveness for decision making. And we want to show you in the coming slides how we came to that conclusion. Next slide. Marcus, I think this one's back to you.
It is indeed. And artistically, this is one of my favorite slides. But if you're living this, it's horrible. Because what it reflects is that what people are forced to do, they're bouncing between, you can tell by all the symbols, between churches, nonprofits, shelters, hospitals, jails. If you look at that person in the middle, God help you if you don't speak English and you're having to go to all these places. Or if you're a person of color, if you're Black or Indigenous, you are confronting all of these systems all of the time and just trying to find yourself a place to sleep every night. So it's not built for premium, optimum usage. The access is poor, and many end up in neighboring Montgomery County, Multnomah County, because there's more resources there. That's not a good way to handle the residents of Washington County. And Mark Jolin and the people at the county who are handling homeless services don't appreciate, they track, they see who's coming in, but they don't appreciate getting all that. And what we're looking at, hopefully with the homeless measure and the housing measure, is some kind of system-wide cooperation where we can address many of these issues. So that's the only thing I wanted to say about this slide. If you're living this life and you're touching all these places back and forth, you are not getting your needs met. And so, Margaret, I'll throw it back to you.
Next slide, please. So this builds on what Marcus was describing. It's really kind of the current state. And again, we gleaned this information from documentation, from focus groups, from big group meetings, individual interviews with frontline folks and folks in leadership at your nonprofit partners and within the county. As Marcus mentioned, people here on the left enter the system, and often they enter the system through kind of those most expensive portals. State hospitals, the police, jail, emergency rooms. Very often people have a number of disabling conditions that sort of force them into those parts of the system, and obviously they're more expensive and less humane and less effective. There are certainly other front doors like churches, shelters, and community-based nonprofits. There is some street outreach. I think Comey mentioned a couple of staff at the point that we did our study late last year. There was only 1.5 FTE dedicated to street outreach. So these are all the places where a person may enter the quote unquote system. From there, they wind up in any number of sort of interventions. And, that can be transitional housing. It could be an emergency shelter. It could be, a health clinic. There's any number of places. Often, veterans are served by the VA. There's a system known as Community Connect, which is really designed, again, it's a HUD construct designed to catch people and channel them to the most helpful intervention given their circumstances. It's also intended to, nationally, it's intended to house the most vulnerable first, the most vulnerable and most expensive first, so that they can make their way towards safety, health, and permanence. Our research told us that Community Connect is partially functional, but certainly not fully functional. And it doesn't capture all the incoming effectively, nor does it entail all the possible housing resources on the far right, which I'll address in a moment. We learned that even county systems have somewhat inconsistent methods between them to identify people who are homeless and get them back inside. I really want to stress that this is pretty common given how local government sources of funds are structured. We've seen it certainly throughout the state of Oregon and in other states as well that we've looked at. Many people actually bounce back to the streets and have to start over again. And of course, the problem on the far right, as this sort of system map displays, is that there's just simply not enough housing. Some of what you have is permanent supportive housing, or PSH light. Comey mentioned you have 34 dedicated PSH units. There are other units that serve in a similar way to PSH, but they, for a variety of reasons, they don't really meet the strict definition of PSH. I think that's it. I guess other than to say, I've worked in a number of other communities. I've studied a number of other communities. Some of this is documented in the report, which I hope all of you will have a chance to fully read. And those communities really aren't too different from Washington County. They have made structural and cultural adjustments and really are starting to bend the curve on the numbers of folks sleeping outside, even in COVID. Next slide. I guess what I would want to underscore here is that if you remember nothing else today, remember this, that doing the same things a little better with the same systems and more money really won't solve the problems that we uncovered in this project. We believe strongly that the time is now to disrupt the system before there's more money masking the underlying problems. Some of you know I'm a former department head at both the state and local levels, And so I have public service in my DNA, and I want to assure you, I see how swamped you are. The demands are piling up, certainly from COVID, but from leadership transitions, the looming economic recession, all of these things coming at you. And it would be tempting to say, we don't have time to deal with this right now. I want to sort of come back to this piece about, we think there are efficiencies to be gained by doing your work differently. Efficiencies both for your provider partners and for your county employees and offices. Right now, you have dozens of committees to staff. That doesn't account for what the cities are doing in and out every day, every week. Our recommendations actually ask you to streamline. Next slide. So what does disruption look like? We think you have to start first and foremost with focusing on chronically homeless as the highest utilizers. We've got some material in the full report that explains why this is so, but suffice to say, there are national studies that really document this idea that housing first combined with permanent supportive housing is much more cost effective. And we think you need to set clear policy that you will spend county controlled money to that policy because of its effectiveness. We actually think that some of the kind of, I'll say, chaos in the system is a result of lots of different bodies making different sets of decisions across the different programs, agencies, and so forth. And there are ways to really disrupt that diffuse governance that we've studied and offered examples of. And we think that that helps considerably with accountability. Now, these are long-term changes. We think you need to start now. And in particular, we want to call out this idea that your culturally competent service providers don't currently have the capacity in Washington County to address the needs as they understand them on the ground. So we think that, getting started on these long-term kind of systems change pieces are really critical. Next slide. This is a little bit hard to read, and again, it's explained more fully in the report, but what this says is, if you take that system that was shown on the earlier slide and do some key things, that this will have a great impact on your effectiveness. Starting on the left, we think you need to considerably strengthen street outreach. And so the hand icon there is intended to represent this idea that a street outreach can be really effective at bringing people inside and meeting them where they're at. The other piece we want to recommend is really concentrating on this Community Connect tool, the other little icon there that's kind of the wheel that's attached to several of the pictures is intended to denote that. Community Connect can be strengthened to be an even stronger way of capturing people across the system and making sure they get channeled to the most effective interventions. The big piece here is in the middle in terms of governance. We're recommending that you establish a new leadership board and that it's comprised at least partially of elected officials. We know that as elected officials, you take a fair amount of the heat anyway, and you're held accountable anyway by citizens and voters. And we think that if you're going to change the way in which decisions get made, it really needs to start from the top. And so we've recommended that you create a single leadership board that really ties together all the decision-making bodies and places them in one place. We know as elected officials, you're not going to have depth of knowledge about technical things, about funding criteria. And so for that reason, we recommend that you formulate task groups. These have been used effectively in other places to advise and float recommendations up to a single accountable body. And then to help make all of that work effectively, you do need a lead administrative organization of some kind. We've seen that happen through community-based nonprofits, through community action agencies, and certainly inside government agencies as well. So we didn't take the step of recommending who should do those things. We just think you need to streamline governance, and that can really address, as I say, the underlying issues. And then we know you're busy building lots more affordable housing with the Metro resources, and we think that's creating more balance there will also, of course, be helpful. That concludes mine. I will turn it back over to Marcus.
So thank you, Margaret. So we're at the end, but here's the first next steps, and you already know you have to do these things. You have to build your Metro, we suggest you build your Metro implementation strategy from these findings. You already know you have to have an implementation strategy as part of the recently enacted dollars that are coming your way. But if you believe the last two slides, which say disrupt, 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 which I do, then if you use these findings to build your strategy, not only can you disrupt, but you can prepare yourself for success as you move forward. The second bullet here, invest now in culturally competent providers. That's preaching to the choir to me. You have to do this. These are your people on the ground. The last slide talked about it, but listen to what they need. Don't make assumptions. If they're providing care and resources and access in their communities, they know what the people that look like them need, that have the same kind of problems and urgencies that they have need. And if you do that, it will be a higher use of your dollars. It won't be redundant dollars. It'll be a good use of your dollars, and you will be getting the highest value of your dollars by spending time and energy and money with your culturally competent providers. We recommend you charge your senior staff with taking concrete steps towards those recommendations, both with the implementation strategy and the culturally competent providers, but also with number 3. You lead the way for cities by aligning all these various funds you have coming in. You have funds coming into the county, safety net funds for continuum of care, ESG, CDBG, Medicaid, behavioral health, all these sources, but they're not always aligned. And your staff sees that, and they have the information. They know what a good use of these resources are. If you take some of the models, the model, but some of the suggestions in this report and weave them into all these various sources of funding, you can have a much more efficient use of your dollars in kind of a synchronized way. And that, I think, is what you're heading for as county commissioners. You want to do that. And it's not to say that we're insensitive. Margaret had mentioned, and it's worth repeating, and it's not lost on us, that you're facing a tripartite pandemic right now between COVID, which you're the county health, you're the health department, so you're dealing with that. You're dealing with the economic impacts of the recession. You're dealing with the societal impacts of all this racism right now. And we're asking you to deal with the fourth pandemic, which is the housing tsunamis that is coming our way. We're not insensitive to that, but if you can align these funds and be mindful of that, and are prepared to, again, this is too harsh a language. You don't have to blow up the system, but there's some opportunities for some efficiencies and some better ways of looking at things if you're willing to make a few disruptions. And, number 4, prepare to invest in change management with your departments. Many of our suggestions are around change management, about coming up with a more efficient and effective system with better accountability. But you have to realize that the baseline is going to be your staff. Your staff are highly skilled. You have highly skilled people at the county who can make these changes and who are better positioned to guide the changes with that board, with some outside guidance, but they have the skill sets. They know where the problems are. They know who the culturally competent providers are, and they know where the funds are coming from. Your staff is strong enough to implement these changes if they have the leadership push from behind from the commissioners. And the last thing I would say is just communicating with the public. You cannot over communicate. to the public, because you can't, there's so many channels and so much information coming in right now. You have to keep them informed. If you keep the public informed, they'll be invested in these changes. They will work with you to make sure that you're implementing the right changes. And the last bullet I'll add, which is number 6, which is not there, as I'll still go back to the last 2 slides: disruption. You have to be prepared to change a few things with how you're approaching this problem. This problem has only gotten more complex in the last decade. The funding streams have only gotten leaner, but you have an opportunity with the money from Metro and doing a little change management with your competent staff, that you can make these changes and it can be good for Washington County. So that's the end of our presentation. We can take questions now, but I would urge you, direct all of your questions to Glenn Montgomery and Margaret Van Vliet, and I will leave it there.
Kevin, do we have Commissioner Willie and Commissioner Rogers online?
Yes, we do. Commissioner Rogers joined about 15 minutes ago.
Okay, Commissioner Rogers and Commissioner Willie, do you have any questions or comments at this point?
This is Roy. No, I don't have any questions. Thank you for the thoughtful presentation. Marcus, I just think you're being chicken, trying to give them all the questions. But all kidding aside, nice shuffle.
I will take questions, but
okay.
I just wanted you to get the right answers.
No, I would agree. Great report and good information. I don't have any questions, though, Mark. It's good to see you.
I think the only comment I'd make, is just the bottom line, is that this whole presentation makes perfectly good sense, and I have some sense, having been on the HPAC for some number of years, and and having discussed these issues off and on at that capacity and also the board level, that this resonates pretty strongly with me, and I think we need to follow the advice that we're getting here. I do see on the housing first, that hasn't changed. I think for some number of years that has been our policy. Years ago now, I guess I'd have to say, Philip Mangano came and through the patronage of our West Side Economic Alliance, and we had a real sort of come to the truth moment with someone who has been one of the pioneers of that concept going back decades now, really. I think I've gotten the sense that we've kind of, we haven't always stayed to that, maybe. There's been, there's pressure to do some other things, and other organizations that work with the homeless don't necessarily use that model, and it's kind of hard to say no sometimes to some of them. But I'm convinced that Housing First is the model, and I really appreciate this report. It's really timely, and I will not be on the board after the end of this year, but pretty excited about the foundations that have been laid in the last couple of years with the Metro funding in particular, and I think we can finally start to get a better handle and do more than just work on the edges here. So thank you.
Commissioner Treese?
Thank you. Thank you for the presentation. I'm a little bit confused, though, about, I heard disrupt. I heard about realigning. I don't understand the hows in here, and I don't understand if this is going to require changes in our existing organizational structure. Is it going to require additional help to or new positions within the organizational structure? So there's a lot of questions that I have about understanding. I do understand the problem that we have better, but I don't understand what the next steps might be.
Thank you. So I agree with Commissioner Treese. It is interesting to hear some of the things about this report, and some of the messages that we've heard articulated today conflict with one another. This is a useful report. This provides a starting point, but it's not a complete starting point. we need to work with our new CAO and set aside some time for us to engage with our staff. I did read the whole report. I think there's more missing. In fact, there is a document that this report mentions that was impossible for me to find. The Housing Justice in Washington County Findings from Coalitions of Color report was not available via the internet at all. I'd like to read that report because this report uses that as a foundation. I do think that this lays out an analysis of some problems as though this model, if only you do this one thing, then perfection will happen. And there's a lot more to it than just what this document enumerates. I think it's unfortunately an oversimplification. There's a leadership ask here. There's a strategic investment ask, and we need to put together a strategic program. There's a financial ask, and there's certainly short-term action and long-term action. But just, I want to say thank you for the report and analysis. And we, as the board, are going to need to engage with our new CAO, who will engage with our staff for us to sort through a multi-step engagement plan together to scope this out further. This report was done before we had it was done last fall, after we had the affordable housing local implementation strategy adopted here at Washington County, and as Comey noted, the commitment to 100 units of permanent supportive housing without an identified financial plan for that. This report was done long before there was a referral for the support services program that the voters approved in May. Thank goodness we have those two programs. I'm very much looking forward to an annual report from our staff about our follow-through on that affordable housing local implementation strategy and what we need to do over the next 3 to 5 years to deliver on that per voter approval. I'm also looking forward to hearing a multi-step approach for how we're going about putting together an implementation strategy for the support services program that the voters approved on the May ballot and what timing that will involve. So I think there's a lot more work to be done, a lot more strategic conversation to come, and to look at how we go about positioning our resources and our very limited resources, and not just our county resources, but this also refers to disruption through our various county partners, both at our city level as well as through nonprofits. We are a collective, interdependent system. And we have a system now, albeit far from perfect, but it is a system. And we can't just pitch it without having something in place during a transition to a better system. Otherwise, there's nothing to serve the need. So that's a different way of saying that we have a complicated roadmap to define and figure out together so that we can deliver on the promise of this report of having a more effective system for the community members, our most vulnerable members who really need our help. So I want to say thank you very much for the report, and we'll go through next steps together when we have our new CAO on board next week. Are there any other questions or comments from commissioners?
Just wondering if there's been any work done yet at the staff level to come up with the first draft of this new disruptive plan.
Well, I'll take a first stab. So I think that what we were looking for today was a head nod to do exactly what Chair Harrington and Commissioner Treese sort of brought up, that this is very high level, and it's very complex, and it would be big changes, and it would involve our community partners, it would involve cities, it would involve you all and other elected officials. So we were just sort of looking for a head nod, should we explore these recommendations further?
So I don't agree with the ask that staff has made here, because what I hear described is, let us as staff go figure out how to get this done. And I think we as the board have to figure out how to get this on our board agenda, how to get this on our board initiatives, because this is not just a staff exercise. This is going to be a very complex strategic program that is going to take leadership at our elected level, through our budget, and how we work with our fellow elected officials and our nonprofit partners to put together a more successful system, while at the same time, we're going to continue to rely on our staff to provide service to the homeless community, service to our homeless community during a public health crisis. While we have an affordable housing program, we have to fulfill commitments onto Metro and a support services program to Metro. It is a very big lift, and it's going to take work from all of us, and that isn't a program that staff can set up alone, which is why I'm recommending that we have the opportunity to work with our new CAO to lay out some of these needs and figure out a path together. It isn't as simple as this conclusion that was provided in our packet. That's my assertion.
Well, I'm a short timer at this point, so I'm in a position to sort of commit
Sure.
with a board or a new board to, but I would urge that the board move this along. And I think that running some kind of a first draft I don't think we should be waiting 3 to 5 years or spend 2 to 3 or 4 years on this. I think that inside a year is I think is a more reasonable amount of time. But
I think we as a board need to have the opportunity to engage with our staff to better understand this over the course of the next few months.
well, that's kind of what I was asking to start with a few minutes ago. Is there already emerging a first draft?
No,
No. Okay.
we have no plan laid out.
And excuse me for interrupting here.
No, I'm finished.
I guess what I need is, as I mentioned earlier, more information. I think this is, to the chair's position, I think it is a big lift, and it involves the collaboration with the cities and other elected leaders. So to reflect on the 6 recommendations, I went through and said, well, yes, sure, we need to do these things, but it doesn't, what isn't here is all the work that needs to happen behind the recommendations. And it does seem like a really intensive, big issue that has to be done correctly. You're absolutely right that we've got all these intersections and inefficiencies within the system, but in my estimation, the worst thing to do would be to have another system that we put in place that has intricacies and difficulties. So I think we need to take the time and do it correctly, and I think we need to take the time with our new CAO, but that doesn't mean that work can't continue until she's ready to take this on. But I think we can refine a lot of what's here.
Put differently, we need to figure out how to approach it.
Yes.
Yep.
Yeah, we'll be happy to brief the new CEO when she gets here. I think the urgency is we have a system that is working with the funding that's available, mostly federal funds and some county general funds. It is serving people, it's evolving, like Commissioner Scouten said, and it's keeping pace. However, with the Metro Supported Housing Funds, we are looking at funding that could be 10 times that. So the question for us is, do we need a new delivery system? Should we wait? Should we, like Marnie mentioned, do we have your head nod to start engaging in this or wait?
It depends. I think the answer is it depends. I think we're reliant upon you to put together a first impression of what this means, but that doesn't mean, yes, go do that.
Okay.
But we've been asked to just approve this and let us go. And that, I'm not there because I know that there's more to it.
I'm not sure I heard that, but
Well, that's really helpful, and I think we're hearing clear. I mean, I think you're giving us what we were asking for. We probably just didn't phrase it very well.
I had the opportunity to talk to Mr. Rhodes about this yesterday. So I know that there's more work that we need. And
A lot of work.
that's the point I'm trying to make here, is that we need to have the opportunity to engage with it.
Yep.
yeah, I don't think anybody disagrees with that. I just, there is a great urgency here, and having spent time on HPAC, what really resonates with me is, that, among other things, to set up a body that would be composed of elected officials across the jurisdictions that have any kind of funding responsibility with respect to these programs. And I think that would be good. I have my doubts about, the ongoing efficiency and usefulness of an HPAC when compared to something like a body of elected officials that would have strong policy recommendations to make, buttressed by good staff work.
Thank you.
Thank you, Commissioners.
Thank you. We'll move on to the next topic on our agenda, August special session update. And we've been given 2 different copies of the same thing.
Oh, I just didn't know if maybe they.
Kevin gave us copies. And do Commissioner Rogers and Commissioner Willie have them?
Forward to them right now.
So Commissioner Willie and Commissioner Rogers, you have an email that's coming your way with a supplemental piece of information for this topic. Let us know when you've received that.
Kevin, would you turn my video back on? It says that you are in control of my video.
Staff will take care of that for you, Commissioner.
Thank you.
So for the record,
Hang on,
Oh.
I want to make sure they have it,
Oh.
because I know you're going to refer to it.
not too much actually, but I was going to start with an apology.
I don't have it.
I'm sorry, Commissioner Rogers, I didn't hear that.
Oh, I'm sorry. I don't have it yet, but that's okay if it's not
It
necessary.
should be there momentarily.
Okay.
Yeah, I have it. Thank you, Kevin.
Okay, great, let's go then.
Great, thanks. For the record, Elizabeth Mazzara Myers, Interim Government Relations Director. I want to start with an apology. I'm sorry to get this is effectively your weekly memo. We wanted to get it to you last evening after the e-board, so we had fresh information off the presses, but as you know, with my other hat on, I was late in the evening working on the listening session, so apologies, this is coming to you late. Fortunately, the phenomenal government relations team is going to provide you the highlights, so please don't feel like you need to read this right now. So I believe first up is Paige Spence.
Great, thanks, Elizabeth. Can everyone hear me okay?
Yep.
Wonderful. Great to see everyone healthy. Good afternoon, Chair Harrington and Commissioners. I will be brief. As Elizabeth mentioned, you do have a weekly memo with some more comprehensive information, but here to give you the highlights and answer any questions if you have them. I will be discussing CARES Act funding, face covering guidance, and recent state legislative activity. It's always nice to be able to start on a positive note. So I did just want to let you know that last week, the Department of Housing and Urban Development released CARES Act funding to help low-income families assisted by housing vouchers during the pandemic. And the Housing Authority of Washington County has received nearly $524,000. Having just heard from our last panel about permanent supportive housing services, I know you know why that's important, so I wanted to flag that. Second, I see you all in your office environment and at home with your masks, and you're probably aware of our governor's recent face covering guidance in office spaces, but I wanted to make sure to flag it for our staff and for your constituents. That last Friday, the governor did release new face covering guidance specifically for office spaces. And now masks are required in public building hallways, bathrooms, elevators, lobbies, break rooms, places like that, other common areas, unless employees are at individual workspaces or in meeting rooms where 6 feet of distance can be maintained. Now, the bulk of our presentation, and I want to focus on the recent activities in Salem that impact our work here at Washington County. I do want to get something on the record, which is that Ways and Means co-chairs are continuing to try very hard to minimize cuts in health, human services, and housing, and just wanted to get that appreciation for their continued efforts on the record. So first, the August 10th special session focused on rebalancing the state budget, brought some good news and bad news for HHS. On the plus side, you'll recall that Washington County's 2020 legislative agenda included an ask for increasing costs to manage caseloads for intellectual and developmental disability clients. And in the special session, DHS, the state agency, received a special purpose appropriation of $100 million for these increased caseload costs. I'm not exactly sure of Washington County's share yet, but we are glad that this funding is here and it should alleviate some concerns that we've had about that funding stream. Unfortunately, we did see cuts to a state mental health program that funds a Washington County HHS program that addresses depression and anxiety in older adults. And we know right now with COVID, there are many isolated older adults that need mental health supports. Within HHS, we do have a specialist being trained to help other organizations take on some of this kind of work. So the county will maintain capacity to keep sort of a skeleton crew going for this important safety net, but without funding for other providers to continue to offer the program, especially in culturally specific ways, its future will be precarious. So government relations, sure.
Back on the intellectual and developmental disability funding.
Yeah.
What was the ask that we had post the 2020 session?
Sure, great question, Chair Harrington. So for the 2020 legislative short session, our ask, which was echoed by our Mental Health Association, was $5 million statewide for county programs and services. The state also has a role in providing these services. So the state agency DHS has received $100 million. I don't yet know what that share to counties will be, but expect that it will actually exceed that $5 million ask. So I'll make sure to update you when we have the information. Does that answer your question?
Yes, thank you.
Okay, great. Sure. So just to wrap that up, as we get ever closer to the 2021 session, preventing budget cuts to our programs that serve vulnerable populations will continue to be at the top of my mind. And now I also wanted to, unless there are other questions about special session, just touch on some COVID-specific relief from the emergency board.
Wait a sec, I have a question on this county law library one.
Oh, sure.
You said that the funding was reduced by $900,000 statewide.
Yeah, so Jagjit is actually going to mention that law library piece in his presentation, but if you'd like, we can pivot to that now.
No, I'll just wait till your order. I was just going through the order of the memo, so I didn't follow.
Absolutely, yes, there's a lot going on. We tend to break it down either by individual portfolio or the other flow that makes sense. So today it was another flow that made sense, but Jagjit will be sure to answer your question.
Yep, thank you.
So just to round off what I wanted to share with you all.
Is on page 4.
Oh, sorry.
You're welcome. Go ahead, Paige, sorry.
Oh, okay, sorry. I'm trying to see your tiny faces on the screen. So the acronym pre-COVID that we never knew we'd rely on so much, PPE, or personal protective equipment. I'm pleased to report that our public health team continues to tell me that we have a healthy supply of PPE, and I know that Clean Water Services has purchased some as well. But Marnie is going to be in touch with Clean Water Services and other departments because we are not certain, what lies ahead. So the emergency board voted on August 17th, yesterday, for a plan to distribute PPE to local governments. And Washington County and 5 other high-need counties. That PPE is first going to be distributed to hospitals, but the remainder will go to Washington County. And PPE will include surgical masks, N95 masks, gowns, face shields, and gloves. And so Washington County will be able to receive about 1.1 million of PPE for our use and for distributing to CBOs and individuals. So that's great news. It will take a couple weeks for that all to flow and be sorted out. But that is really good news as we go into a fall with many questions around COVID spread. And finally, just as a refresher, the e-board had also convened on August 5th. And in that e-board meeting approved a $94.2 million statewide allocation of CRF dollars for COVID contact tracing and testing. I just wanted to be sure to reflag that because as you all know, Washington County got direct CRF allocations, and by and large, the state has been using CRF dollars on those counties and cities who did not get direct allocations. But with Washington County and the other direct allocation jurisdictions were included. So I just wanted to make you all aware of that as well. And so out of that $94.2 million, Washington County Public Health will receive roughly a $6 million allocation. And that is all I have for you, unless there are questions.
I'm grateful that we have staff to keep track of all these numbers, and I don't have to.
Great. Well, I'll turn it over to Jagjit.
Good afternoon, Chair Harrington, Board of Commissioners. For the record, my name is Jagjit Nagra, Government Relations Manager for Washington County. I'd like to turn your attention to page number 2 of the memo. This is what the chair had already pointed out, around $900,000 statewide cut to county law libraries. Now, this particular stream of state funding is bifurcated for us at the county. It goes to 2 discrete areas. 40% of the funds that we receive from the county law library's funds goes to county law library operations, as one would assume. 60% of that fund, however, goes to juvenile conciliation services. Now, conciliation services are provided for mediation and counseling services to parents involved in domestic relations court for custody decisions. It's state mandated by ORS statute. And so these funds in both areas, in both respects, are critical, right? It keeps the lights on and operations on our law library and provides a state mandated important conciliation service for folks going through difficult times in regard to or in relation to our juvenile department. This $900,000 cut statewide, we are, Aaron Calvert, our Deputy Director, along with Lee Van Duzer, Director of our Law Library, and Lynn Schroeder, Director of Juvenile Services, are all getting together tomorrow to really hash out the numbers and see what this means for us. But here's what I'm here to tell you one thing. It's not going to be good. The reason for that, this one stream that amounts to 2 different important buckets for the county for over the past decade has not been re-upped or in any way increased. And so we have been using, both the law library and the conciliation services have been digging into their reserve funds. Now with this additional blow and this additional constraint, it's going to be tough. It's going to be tough.
Yep. And I, for one, from a political leadership standpoint, I'm not willing for us to have to make up the difference out of our reserve funds. We have tremendous unmet human needs here in Washington County, and I think we'll have no other alternative but to cut hours for things like the operations of the law library. I understand that we're required by the state to have a law library, but if they're going to cut essential funds, we're going to have to cut back services.
You're exactly right, Chair. One of the 2 policy solutions that I have been considering that hopefully are painless, but will likely be painful, One at the state level would be to advance a bill, and I've already talked to Lane County and Clackamas County, who are also having disparate impact due to this budget cut for state law library funding or county law library funding, is to advance a bill that would restore the funds and to go back to the older fee-based model. This would be the preference for the law library and for the conciliation services. So this is one thing to consider. The other thing to consider is to continue lobbying our federal delegation and our federal government to provide a long overdue federal package for local governments. The state could then use to backfill these funds, possibly. That's a longer, both of these in my mind are longer term plays. Over the last few months, government relations, I think all four of us have told you headwinds are coming in terms of state budget cuts. And now the rubber is hitting the road in a non-savory fashion. So that's one of the disparate impacts from Senate Bill 5723, the Omnibus Budget Adjustment Bill. This is also the bill that Paige was referencing. Another disparate impact is around grand jury recordation. If you recall, during the past short session, I fought hard to try to get these funds increased because this is another state mandate that we do this, and best practices in regard to judicial procedures mandate that we do this. And so it's a great thing. However, grand jury recordation requires staff, it requires space for the actual physical storage, and it requires IT costs as well. And so what ended up happening is that this budget adjustment bill eliminated the $3 million appropriation for grand jury recordation expenses, and we went back to the $500,000 negotiated 2019 budget note. That $500,000 amount is statewide. We have 36 counties. As you can imagine, that recordation dollars will go by very quickly and will not meet most of our needs. Excuse me. I want to shift now over to public safety for a brief moment. Last week, I provided you with a fairly in-depth overview of the 6 bills that passed in the special session number 1. We've been focusing today's presentation on special session number 2, and of course the e-board that took place this week. As a reminder, from special session number 2, there was one public safety policy bill that passed. It was House Bill 4301. This was the chokehold bill that was further nuanced and had further definitions and further constraints around who was included in this bill, and we talked about that last week. I'm glad to take any questions there. The thing I want to point out about police reform is that more bills are going to be coming, and this is the message I shared with you last week. I talked with AOC this morning and a few legislators, and they're indicating there could be a special session the week of legislative days. If I'm not mistaken, that's the week, the 21st or thereabouts in September.
23rd,
now,
25th.
For those of you who are keen listeners, that's prior to the September 24th revenue. So this means that we possibly could be in a situation where we're doing a readjustment of budget bills at the state level, and also possibly considering policy bills related to public safety. So I just want to put that on your radar that more could be coming. I also want to flag what was not discussed during this last special session, something that's very important for both the county and healthcare providers and businesses, and that's the issue of liability. Not discussed. The work group also has taken, from what I understand, a brief pause to discuss, I haven't gotten clarity as to why that pause is taking place, but no direction has emanated from that work group to discuss liability as well. As you know, we are 2,600 county employees. We provide a lot of services. These liability conversations are exceedingly important. With that, I will conclude and take any questions.
I've heard the same thing. There will be a special session during September legislative days, but how many days in that week they're going to do that, we're still trying to sort out.
Commissioner Scouten, you trailed off, I'm sorry.
I said the precise number of days that they're going to be doing this in legislative days is not entirely clear, but there's almost no doubt there will be another session during the September legislative days.
Exactly.
So,
I'm sorry.
oh, go ahead, Roy. Go ahead, Commissioner Rogers.
Thank you. Gigi, one of the things I think that might be interesting for all of us is on that liability portion. In the business community, we well understand that there's a lot of risk. I'm not so certain it's real clear in the governmental, but I think you just did a good job of explaining why it's important. But is there some piece that you might be able to do to maybe inform not only all of us, but others who might have an interest, meaning staff, as to the potential exposures we have from not dealing with this this particular issue of liability reform.
Absolutely, Commissioner. I'll put something together and I'll share it with the board.
Thank you.
I take it we still have another piece?
No.
Oh.
No, we just wanted to, we had just 20 minutes. We wanted to just give you the highlights and see if there were questions. And then, of course, always make the team available if you want to go a deeper dive into some of the other issues that were dealt with.
So, in my view, there was a special session. They had a rebalancing of the budget, but they did so by just cutting services in certain areas, and now we're trying to take stock based upon those statewide cuts of what it means down here at our level. So I'll look to our CAO to schedule a report back to us of comprehensively from the county. This is what those cutbacks from the August legislative session look like. Then I think the state has done a good job, and you guys have touched on it in our different updates, that the budget forecast for the next biennium is worse than what we're currently in. And so we'll have to, we've set our sights on an update through the state forecast the end of September. So frankly, from my viewpoint, they can have a special session every single week. So I'm not all tied up in what the next special session might be. And part of that is really a compliment to the four of you, because I know that you stay in tune with what is building, and you give us a heads up of what the theme might be. And then you try to, and you do your best to touch point with us to see if there's any government relations agenda going into those special sessions, and then touching back with us on what the state of affairs is. So process-wise, you've got me. And I know that you're going to serve us well, no matter how uncertain those waters will be. So I know I don't have any specific questions. You've given me a good broad brush stroke summary of what the August special session did. And I've heard from you that you're working with the department so we can really internalize what those impacts may be, so that as a county we can then figure out our steps from there. Did I summarize that sufficiently or correctly?
I believe so.
Oh my goodness, you've got me on it. Oh, Commissioner Willie.
Yeah, and thank you, Chair. I want to go back to something that you just said a few minutes ago, and that is I need to get a little bit more clear picture of all the areas that they are talking about as far as state-funded cuts, so I can better understand where it is that we should be focusing our emphasis. I mean, we talked about the $900,000 and 40% going to the library and 60% to juvenile. And of course, I don't know much about the library, but I certainly know because of the committee I'm on that the impact to juvenile is going to be significant. And as you pointed out, Jajit, we've already endured some of those for a number of years, and we're already operating in a deficit position. So I'd like to see a little bit more about how we're going to deal with that. But I want to have a complete overall picture of what we're anticipating for state cuts and how deep that cut's going to be. I guess before I start watching to see how Jack and everybody else works on what we're going to do with less money. So that would be my only question or ask.
And if I could, I think you're sort of calling our cards on what's next, Commissioner Willie, is we will be working with Jack to review the information we have, get a better insight with program directors, and be reporting back, although, again, everything is sort of a moving target, but we will do our best to provide you an analysis of that. I did want to say as well, next week we are back again, actually with our full team. So our lobbyists from Van Scoik will be with us online, and we'll be providing you a longer-term calendar. There have been some updates given COVID and so many special sessions and e-boards, and so we're wanting to provide you an update on where government relations is, where we're headed, and hopefully be able to schedule in some of those report backs on impacts for you between now and then, so you have a sense of what that looks like.
Commissioners, any last questions? No? Great.
Thank you.
Very much. Appreciate the
Thank you.
update. All righty. The next item on our agenda is the Clean Water Advisory Committee recruitment update. Mark Jockers.
Thank you, Chair and members of the Commission. We're bringing this item to you. We have 3 openings on our Advisory Commission right now. In 2 weeks, we will be bringing 2 of them to you to take action on. The 3 openings are an environmental representative position that was previously held by Chris Ballier, who is the Executive Director of Tualatin Riverkeepers. Chris stepped down from that position last December, and with that also stepped down from the Advisory Commission. So at your direction, we re-recruited for that position beginning in February, and we'll be bringing recommendations to you. That the 2 recommendations applicants that we received one is Tom Beck, who is the Fernhill Wetlands Council founder and is also on the Forest Grove Planning Commission. And the other one is Jan Wilson, who's the new executive director for Tualatin Riverkeepers. The other 2 positions that are open is we are continuing to struggle to find an agricultural representative to serve on the commission. We have 2 agricultural representatives on the commission. One is John Jackson, who's currently serving. The other we need to recruit for. So we're continuing to do that. And then the third open position is a city rep. The cities send representatives to our commission. It's a non-voting position. That representative is typically recommended by something called the County Managers Group, which is a group of city managers here in the basin. We had 2 city managers who expressed an interest in serving on the commission in the upcoming years. We drew lots on that, I guess, and Sherilyn Lombos will be our recommendation for the permanent city rep, and then Joe Gall would serve as an alternate as a city rep there. And we'll bring both those items to you on, what is that, September 1st, I believe. Do you have any questions on that? Or?
Are you making recommendations at this point for the maybe, or are you still?
You know, certainly that's the board's discretion.
Of course.
I think for continuity-wise, Jan would be a good member to join. Since Chris had joined previously, Riverkeepers are a well-recognized advocacy group here in the basin and a well-recognized environmental group. And to be able to secure their executive director on our commission would be, I think, would be a real win for us.
I think Commissioner Rogers or Commissioner Willie, you're still on mute, so I take it that you didn't have anything to mention at this moment. I think that of the 2 for the environmental representative, I think Jan stands out as you've highlighted. On the agriculture rep, we talked previously about how Nicole from the OSU extension was helping to recruit. Have we dried out that well?
I don't think we've dried it up. I think we need to go back to the well to see whether it's fully dry.
Well, the one thing that I wonder about is sort of the work program, without a formal work program, but the work of CWAC ebbs and flows over
Yes.
the years. And you've completed quite a impressive few policy years.
Mm-hmm.
And this is where I appreciated Dave Waffles' expertise, because he was also on the Watershed
Yes.
Council. And he could talk policy, and he could also talk numbers. And that's a rare individual.
Yes.
But I'm wondering, back to the ebb and the flow, if there's anything we or I could do to help lay out a picture with some ag folks of why this might be compelling for them, for their time, and what degree it has policy work going on in the future, or is it just about numbers or whatnot? So I wanted to just inquire a little bit there, and maybe I
Okay.
need to talk offline.
I think the most obvious issue is the Scoggins Dam project.
Yeah.
54% of the water there is provided to the Tualatin Valley Irrigation District. We have a very close relationship with their general manager and their board already. That's good, but that is going to continue on, that issue. That's 17,000 acres of irrigated cropland that comes out of that. The other issue is also obviously water related, but also related to long-term water supply needs, is expansion of reuse. So currently, Clean Water Services is the largest reuse water provider in the state of Oregon, but most all of that goes on to agricultural fields and athletic fields, and parks, and pieces like that. I'm sorry, I didn't say agriculture, onto parks and athletic fields. As we look at expanding our reuse program, we look at where that might be in terms of agriculture, where we can either provide irrigation to agriculture that's currently provided, doesn't have irrigation, or if we can trade out for existing water that's pulled out of the dam instead to provide this other water to meet our long-term needs.
And I just want to make sure that for the member city representatives, that they know this isn't just about costs and numbers.
Yeah, we've been very, very fortunate in the sense that we have city managers who have an interest in this, where previously it used to be more the public works or the engineers piece. We need those policy level people, and that's where Sherilyn and Joe, I think, will bring
Great.
tremendous
Good,
insight to us.
Great, excellent. I wanted to inquire about that, so I'm glad to hear that. Commissioners, any other thoughts you want to share with Mark? Nope. I think we're ready to proceed.
Thank you very much. We'll be back with you in 2 weeks then.
Great. Thank you. That's it for our work session agenda for today. Do commissioners have anything else?
Nope.
Nope. Okay. Well, that's it then. We're adjourned for our work session of August 18th. Thank you.